This is Harry. We'll be starting in just a minute. We'd love if anyone let us know what part of the country you're in the chat. It's always just nice to get a quick check on that. John and I are both in California. John's in Southern California. I'm in Central California, if you want to know where we are. And we'll be starting in about a minute, maybe even less. Georgia, I see. Nebraska, Louisiana, New Orleans, San Francisco, Philadelphia, Indiana, San Diego. All right, we got some hometown, Miami Beach, Kansas, Florida, snowy Connecticut, Missouri. All right, Florida, Pennsylvania, if I didn't say that. Well, John, I think Indiana, Missouri, I think we're about to get started, folks. So this is Harry, and you're not going to see much from me. You'll hear me every now and again, but I want to introduce really the host today and the guy that really knows everything about the Doctable software, John Flores. John is our product manager. I'm just so happy that he's taken the time to be with us here today. And John, please tell everybody a little bit about yourself and take it away.
Yeah, hey everyone. Looks like we've got a bit of a melting pot, so to speak, of customers from all around the country. Welcome. Thank you for taking time out of your day. My name's John. Like Harry said, I'm product manager here at Doctable. I've been working at Doctable for around 5 years now, and my job really is to help your voices be heard and really get your input and improve our products the way that our customers, yourselves, really want it. With that being said, we can go to our agenda. Actually, of course, this being a webinar, I want to encourage everyone to ask questions whenever you want. We'll go ahead and take a pause and answer those questions as they come in. And then again, if something comes up, maybe it's off topic or something comes out of your mind at a later time, we'll be hosting a Q&A session at the end of this, where you can ask questions a bit more detailed as well. All right, yeah, what are we going to talk about today? First of all, I want to look back at 2021, and I want to touch on three main things. The first being feature updates and how we've provided some smaller features that really had a large impact, and how we're saving offices time with improved integrations. Then I want to talk about two new product offerings that we've had this year, or sorry, this past year. It's 2022 now, but in 2021, we added smart messaging, and we'll talk about what smart messaging is and how that gets set up. And then we also most recently launched a digital forms product. And we'll talk again about some of the flexible new features that we have and the control that we're providing for your offices. And then at the end, like I mentioned, we'll be having an extended Q&A session. All right. So feature updates. Our goal this year was to build on our core products being our patient communicator, our patient reminders, and our virtual waiting room, with our emphasis being focusing on providing ease of use and visibility to practices. And then along with that, we improved our existing integrations to help build on the core products, specifically patient reminders. All right. As product manager,
John, just let me know if you want to go to the next slide.
Yeah. Okay. Yeah. As product manager, my job is to provide simple changes that have a large impact to practices. And one way that we did that in the last year was by improving our visibility of patient information. So what we did was we added simple indicators like date of birth, which is available in both the search bar and in the contact information. But we also added patient status so that practices can be aware of what type of patient they're speaking with. And that's again available in the contact information panel within our patient. Another simple change that has a really large impact on the look and the feel of the product is real-time messaging. This is actually something that took us a while to implement, but really it drastically improved the performance and the usability of our product. So when I talk about focusing on ease of use, what I'm talking about is something like real-time messaging, where we can instantaneously send and receive text messages with your patients, right? So this is going to be perfect for back and forth conversation and really opening that transparent communication channel with your patients to really make our product feel like it's an iPhone and you're messaging your patient back and forth. So this is a really small change that we made that actually we got a ton of feedback as soon as we launched it. People just were, hey, the messages feel different now. Again, the small changes with a large impact is kind of what our focus was on in 2021.
John, if we could quantify that, I think before it might have taken a minute or two, you might have had to refresh the patient communicator. Now you don't have to refresh. And as soon as the patient sends the message, it might pop into your window within a few seconds.
Yeah, it's near instantaneous. Before, like you said, it would take maybe 30 seconds to a minute, sometimes longer, depending on cell coverage or something like that. But now it's essentially like you're just chatting with someone. Next slide, please. Thank you. Yeah, so improved integrations. When we talk about improved integrations, we're talking about saving you time. And the biggest way we can do that is write back. So essentially, write back is writing back to your practice management software so that we can confirm appointments without having any involvement. So we'll send them an appointment confirmation request. The patient will confirm their appointment, and then we'll mark that appointment status as confirmed within your practice management software. And 2021, we did that for some of our main verticals and some of the biggest practice management softwares for those verticals. We added Write Back for OfficeMate, we added Write Back for Open Dental and Easy Dental, and then we also added a Recall for Easy Dental. I know that's not listed here in Write Back, but again, a way for you to recoup patients who otherwise may have not come to see you.
We have just this little video to just illustrate the idea.
With all major practice management software, and thereby reduces the need to perform manual tasks. Everything is automated and seamless.
I'll just play that one more time, just so you get the idea.
Doctable integrates with all major practice management software, and thereby reduces the need to perform manual tasks. Everything is automated and seamless.
All right, and we have a question.
Yeah, I see that. Noemi, is there a way to create groups and limit who has access to patient feedback? That's a good question. Actually, it's something I'm planning to address this year, hopefully around the next quarter or so. But customers have requested to essentially allow practice users, your staff, to limit parts of our dashboard they're seeing. So we want to limit them who has access to that feedback. And that's something that we're planning to address this year, certainly. Another one from Denora, can we integrate with MD Office? I don't believe that's an integration we're currently off. And the same here from Help Desk. API to integrate with Open EMR. Again, I'm not sure. I'm fairly certain that's not one we're currently offering, but that's something that we can certainly look into. And again, from Denise, will Mogo be integrated? I think we do integrate with certain versions of Mogo. I'd have to double check on our integration list. Denora, do we do auto recalls? Yeah, we do. We do automatic recalls. Yes. David Lorino, conductable right back to the HR for history and demos. I'm assuming you're referencing certain sections of the appointment or patient. Right now, we're currently writing back to appointment status or confirmed status with the goal to expand the fields that we're working with. Denora, if we're not integrated with MDO, how can we do auto recalls? Oh, yes. Sorry, I must have not connected that you were the person who asked about MDO. So for the practice management softwares that we are integrated with, we do provide auto recalls. Unfortunately, I don't think we're integrated right now with MDO, but again, something we can look into adding. At that point, we would provide recall.
So I have a list of all these questions we'll save out, and I'll try to get I will get your emails to John or somebody else on the team so we can definitively get back to everybody in one way or another. And John, back to you.
Yeah, certainly. If you can go to the next slide. Integrates with all major practice management software. Another thing that we did this year, specifically, I want to take a moment to talk about virtual waiting room product. So essentially, virtual waiting room, what we've done is automate and virtualize the patient check-in process. So typically, the breakdown goes, well, we'll send a patient a health screening form a few days before their appointment, and assuming they pass the health screening check, we'll send them a check-in message the day of their appointment, letting them know that they should reply when they're at the office. And then when they arrive to the office, they can reply here, and practice will be alerted. So your staff will be alerted that they've arrived. And then you can, with the click of a button, check that patient in. And what we saw in the last year, specifically with some of the COVID restrictions easing up and more people being vaccinated and some practice workflows changing a bit, there was a large request from some of our customers to have that convenience of the automated check-ins, essentially asking practice or patients to reply here when they're at the office, and then practice alerted, and then they can check them in without needing to send that initial health check-in survey. And now we realize certainly that COVID has once again impacted how a practice is run. And I just wanted to let everyone know that we as Doctable are listening. And this coming Friday, February 4th, if you do have virtual waiting room, we will be hosting a listening session just for you to share your feedback on how your practice is currently using virtual waiting room and what things you'd like to see from virtual waiting room. And again, we'll be posting some more announcements for that this coming week. You might see that in your dashboard if you're a current customer of virtual. And then lastly, I want to touch on growing with you. So some of the things that go on behind the scenes, obviously not the prettiest, but one thing that we did this year was we improved our infrastructure. So not only did we add those features like instantaneous messaging, but we have to provide that reliably to customers who are using our products at an exponential rate. So what you'll see here, usually you'll see like a linear line go like this, but our customers are sending messages at an exponential rate where it's more like a J, right? Which is over the last year, we sent 35 million messages. And we had to do that with instantaneous messaging abilities. And again, adding additional message types like virtual waiting room and some of these other messages. Our goal is to really provide you with the most reliable method possible to send messages.
Is repetitive patient communication overwhelming staff resources? Automate frequent or repetitive patient communication using email and/or text messages. Doctable Smart Messaging is customized to your practice and will be up and running in less than a week. Free up staff to focus on delivering meaningful patient care. Smart Messaging can prevent reschedules, late shows and no-shows, and improve patient experience by creating patient onboarding workflows or aftercare processes. Messages are triggered by changes to appointment status. Status is updated using an integration to your EHR or practice management system. Each message can be customized by provider, procedure, or operatory. Create messages with onboarding, screening, or consent forms by including links to HIPAA-compliant forms. Create messages for new patients, telehealth, or aftercare questions. The possibilities are nearly unlimited. The impact on patient experience is outstanding. Give us a call so we can explore the possibilities and help you get started.
Awesome. So what was that video about? That was our one of our newer feature offerings called Smart Messaging, so that we're automating repetitive tasks and really tailoring our message to your patients and tailoring that to your workflow. I had a couple of questions while that video was running. I wanted to get to Noemi. He says, how can we create a repetitive message reminding patients that masks are required versus sending them manually? Smart messaging is one way to do that, and we can talk about that in just a second. Denise asks if this feature is an additional cost. I'm not the person to be asking about billing. I'm certainly a representative can help you and see where that fits in your practice. And then Shayna, able to be integrated with NextGen. The answer is yes. NextGen. Harry, you can go to the next slide.
I just wanted to, obviously, if someone has questions on pricing or whatever, we can have someone obviously get back to you. Generally, Doctable, there's tiers of products. We have a gold level package that gives you almost everything. Some folks just have reputation management. So it really depends on where you are and what you need. And the team is really good at creating a customized bundle that's just the parts that you need. But I really don't want to make this into a sales pitch. That's not our goal today. So let me go to the next slide.
Okay, yeah, smart messaging. Yeah, essentially what is smart messaging? We created a way to send automatically reminders for messages. We're really communicating with your appointments, right? So if they have a specific provider, if the appointment is a specific appointment type, if they have a specific status or in a specific operatory, we can send them a different message than the other messages that we send, or we can send them only a specific message and then not allow them to receive any other types of messages. So a couple of examples that we have here, we can send a 3-day post-appointment reminder after they've had an oral surgery appointment. So we want to tell them, check in with them, see how they're doing, how they're feeling. Or we can send a 2-day pre-appointment reminder for a new patient, right? So an appointment with a new patient service or a new patient type. And this, again, could be to tell them to come to the office 30 minutes early to fill out forms, or you can add a link to your own forms, etc. I got a couple questions here I want to address. Okay, see, Michael asked if Doctable is limited to patient communication in English, or could languages like Spanish, Mandarin, Vietnamese be used as well? We do have customers who utilize our platform for other languages. I think it really depends on the use case that you're looking for. Well, I've seen customers messaging people in Spanish. I've seen Korean. We've got quite a mix of customers using it in diverse ways. Smart messaging is one way you can send messages. If the data is present for us, we can send messages to people who are speaking one language over another. It really depends on your office workflow, and that's something you'll have to likely consult with one of our representatives to discuss. Let's see here. We got a message from Lisa. Is there a way that each user that uses Doctable can send text messages to receive their own text message response back instead of having multiple messages in one large text pool? Or is there a way to group each colored flag messages? Yeah, so we do currently have flags, and we also will separate them by send. In our flagged inbox right now, you can sort them by flag color, I believe. So that's one way to do it. You can also look to see who is sending the messages. So for example, if Amy is on a purple flag and she's the only one sending this specific patient messages, you can see who was sending those messages. We denote that in our patient communicator. Another question from David. We're trying to eliminate forms altogether. So when will doctor be able to read and write directly into the EHR? Talking about reading and write forms, something we're currently looking into, and hopefully we'll be able to provide something like this year. Okay, I believe I've addressed all the questions, and we can go to the next slide.
There was one about next-gen integration.
Yeah, I addressed that one.
Okay, cool.
Do you separate by senders to a group other than colored flags, and how do you sort by flag color? Okay. Other than colored flags, sorry, we're not currently separating by senders. I just meant that we're visually displaying which senders types, but these are good things. We're actually planning to address the way we're sorting our inbox to provide, again, more ease of use for customers. So now I'm understanding you'd like to sort by senders. Something that I will personally see to, that we can provide something like that for you. And sorting by flag color, once you're in the flagged inbox, I believe you can just select a flag color and it'll sort that.
We'll record a little video or something and send that to you, Lisa. And this is great. We love getting these questions. So this is great. We have another one that came in from Micah. We especially like Doctable for patient reviews. Please explain how that works. A lot of our patients don't leave one because they say it's too complicated. Why?
Yeah, that's a good question. Doctable actually has one of the simplest review processes. Essentially, we send a text or an email to the patient, and then from there, they'll get a review page link that asks them if they've had a good experience. They can leave a review on Google or Facebook or whatever social media you've connected or implied. And then if they didn't have a good experience, they could write you some feedback. It's complicated is very subjective. I think some patients will find it really easy, and then some patients may have more difficulty. The system's really designed to capture the most feedback possible, and a lot of practices do find great success with it.
We will be doing a webinar just on reputation management sometime in February, I believe the 9th, but I'd have to double check. And it's certainly best practice to make sure everybody's getting a review request, but that's something we'll address on that webinar.
Yeah, certainly. So feel free to join us for that one as well. So just commented, says it's a pain to have so many text messages to look at for others in your office. Definitely agree. And so we're working on ways to visualization of your messages in our page communicator easier and better. Okay, so this slide here is talking about generic smart messaging setup recipe. When we're looking at setting up smart messaging, what are we looking at? There's 5 main things, right? The first one is who do we want to send the message to? The second thing is what do we want the message to say? The third would be when do you want the message to be sent, and how do you want it to be sent? Do you want that to be email? Do you want that to be? And then the last part is the why, right? Why do you want the message to send, so we can understand how we're going to implement this with our current reminder cadence. So some people would like all messages to be sent, including this one, to a patient who has a specific appointment type, say a new patient, where they want them to receive all these messages, an additional message. Some people would only want, say, a telehealth appointment to receive this message and no other message types. Again, this is a reason why we want to understand the why behind the message.
So this would potentially work in the case of the mask, that obviously the people getting the telehealth wouldn't get that message, but you could send it to everybody else a day before the appointment or something like that.
Yeah, exactly. And we can set up a smart message depending on if you want to send everyone that's coming to the office a message to let them know that masks are required. And we can certainly add that, or we can send it to only certain patients. It's really practice preference that we would work with our customer support team on. You can go to the next slide for us, Harry.
Sylvia has a question there.
The smart message, look to the type of appointment. Yes, certainly. It could be set up to the appointment type. It could be set up to patient status, appointment status. So we can send it to only appointments who are confirmed. A couple of different criteria. And I would certainly love for you to talk about your use case with one of our representatives if you think that. Yeah, so here we'll just look at an example. So pediatric post-care guidance. So who question, right? Who do you want to send it to? We want to send it to patients who have an appointment type of 3 to 5 day newborn checkup. What do we want to send them after their appointment? We want to send them guidance and typically their first year appointment schedules for newborns. They're seen usually every 2 months for the first year. The when is 24 hours after their appointment. So we're going to send them this message day after they've had their appointment, and we'll send them to via text and email, the how, and then the why, or the reminder logic here, is in addition to their regular reminders and confirmations. We're going to send them. Harry, you can go to the next slide for me. And we'll look at another example here, but essentially our telehealth onboarding process. Again, an example would be new patients, right? So we want to send new patients who are going to be seen for telehealth we want to request them to fill out consent and intake forms and send their insurance. So we'll send this message 4 days before their appointment, if their appointment's confirmed, just so that we're not sending it to everyone and then they end up not confirming and not showing up to their appointment. And we'll send that only via text. And again, in addition to no reminders or confirmations, but it could also be by itself. Independent patients that are at telehealth, they can only receive this message and then they don't receive a confirmation request or a reminder. Again, this is our practice preference and something that our customer support team would love to help you set up.
Supercharge your practice with Doctable's digital forms. Use open-ended questions, drop-downs, and radio buttons, and open-ended matrix, or single-choice per-line matrix questions. Patients can add additional lines, for example, when inputting medication history. Rules, hide or show questions or consent forms based on a prior answer. Try Doctable's digital forms today.
Awesome. Yeah, so that was a brief look at digital forms, essentially as the newest module that we're offering here with an improved functionality on our previous forms offering. And we'll talk a bit about what this is and how that can work for your practice if you go to the next slide here. So we provide a dashboard for you. And in this dashboard, you'll be able to send clients forms. You'll be able to see client forms. You'll be able to see pending forms. You can manage your templates. There's a lot of customization here that's all open to the practice so that they can really tailor digital forms to their own workflow. If you go to the next slide.
Shana has a question.
Oh, sorry, I didn't see that.
We go through text messages, and I think we should talk about the features of the existing product versus the new product, because there's some limitations to both. But the short answer is that you can, with the new product, generate a URL and text that to somebody using practice management. I'll let John pick up the rest.
Yeah, definitely good question there. So yeah, so there's two ways to send this. The first one, which I'd suggest, is to generate the URL and then embed that in a message that we're sending. There's also an alternative. You could send them directly from this dashboard as well. Both are sent securely, so you don't have to worry about any security. Doctable always takes security with the highest precaution. So Doctable's HIPAA secure, and we ensure that everything else that we're providing for you is taken with the same precautions. Way to format the responses from the questions to make it a narrative. Yeah, I believe so. There's definitely a lot of customization here. And if we get to this and we can go to the next couple of slides, we can review that for you so you can see how that would fit in with you. Okay, so we've got two, once we click on that red button that said manage templates, we'll be taken to this screen here. I mean, you'll see there's questionnaires and there's consent forms. And the biggest difference between questionnaires and consent forms is the questionnaires are your typical intake form types where you're asking patients questions and they're filling those questions out, whereas consent forms are typically large bodies of text that a patient will consent to, and you have to get some type of signature. If we go to the next slide, you'll see actually we can build questionnaires that are bundles of consent and intake forms. So you can ask questions and you can add pieces of consent. If a patient is a new patient and you want to intake them, you have them fill out information regarding their visit, and then you also have them consent to HIPAA and release their medical records, like in this example here. If you can go to the next slide for us. We touched on this briefly, but you can send them directly within our dashboard on this page. You can send them an SMS or you can send them an email. You can type instructions and select your form. Alternatively, you can get a public-facing URL for the desired form that you have, and you can enter that in a templates that we have, or you can enter those manually in the patient communicator.
If you're an existing Doctable customer using integrations, you probably want to use the URL as John's recommended, because these currently are not sent through Patient Manager. If you use this SMS option, so the URL would be the most seamless patient-focused option, in my opinion.
Yeah, good point here. Yeah, you can take us to the next. Another great feature within the dashboard is you can click at the big green button that says See Client Forms, and it will provide you with a lot of different ways to access your forms. So you can search by the client, the fill status, when they finished it, what form it was, for which practitioner or provider it was for. And then from there, you can print the form that opens up a PDF, and then you can print that or save that. And you can download the form, or you can just view the form as it's been filled out or partially filled out, as we'll get to in just a minute. But you can go to the next slide here for us, Harry. So when we talk about building a questionnaire or an intake, for what you'll see here is on the left-hand side, a ton of control. You can move questions around. You can free form a question. And you can also select from the provided question types, right? So we have a large amount of question types with various functions, right? So there's a body map, the e-signature, matrix one, so you can have them fill out a table. And if you see there's a little example text next to it. If you have a question on what question type type you're going to insert into your intake form, you hover on the example type, and then Harry, if you go to the next slide, you'll see that the dashboard provides you with examples of exactly what the patient would see on their form. So again, a lot of functionality when you're building your forms. If we go to the next slide, I believe we're talking about building consent forms. So we're just talking about building questionnaires and asking questions. And so you see fit within that thing, I believe, Yemi, that question about formatting the responses from the questions, all of that would be done on that page that I was just referring to. And again, this is more meant to be a high-level overview. I'd love if you have more questions on this, someone can reach out to you and we can talk more a bit about what precisely forms you can set up. The second option here is building a consent form. So we have two options when you're building a consent form. Again, consent form is usually a large body of text a patient will fill out, basically consent to. So you can select rich text template, or you can upload a PDF. If we go to the next slide, we'll see what the rich text template looks like.
I was going to say one use case, I think, besides consent might be if you have like very specific pre or post procedure instructions that essentially you want someone to consent to, right? That you've read and acknowledged, that would work in this case.
Yes, absolutely. Yeah, again, if you wanted to fill out that body of text, you'd put that here in the form content. Again, this is an editor that allows you to bold, italic, so underscore, or basically edit your text any way you want. And then this will be shown on the consent form. And here you can add e-signatures and other templates, variables. There you go. Sorry, the word wouldn't come to me. But you can add other variables like client name or practitioner name, and those will be filled in within the form content. The next slide, what you'll see is this is a quick little GIF of uploading PDF. So if you have an existing PDF of your practice consent form, and you don't really want to type all that out, we allow practitioners to upload that. And then from there, you can insert signatures as is being shown on the screen. And then a really quick, easy way to not interrupt any practice workflow to upload existing forms.
I wanted to touch slightly quickly on, I don't know if it fits into that narrative question, but there are rules. So you can ask a question where you referred. If they say yes, you could then ask, were you referred by a patient or a doctor? And then depending on what they answer, ask them the next question in the series.
Yeah, absolutely. You can basically form them on a specific path based on the answers that they're given. And again, I previously touched on, but when you're viewing a form, you can see them fill out their data in real time.
John, if I could jump in here. So when John's going to talk about the real-time data, I think this is something that you would not see if you're using that URL method that we've mentioned, where you're sending the URL. Right. Although this is a nice feature, and John can talk about the future of it, I just want to point that out. If you're already an integrated customer with Doctable, this is a feature you probably wouldn't use because it's better to send the URL for simplicity and patient experience.
Yeah, absolutely. So again, this would be from sending directly from the dashboard. And again, in the future, it'd be nice for us to improve on seeing what exactly is being filled out and when as it goes and within the dashboard. Yeah, again, this is pretty much our new digital forms offering. I'd like to open it now, I think, for any questions or comments. It doesn't have to be related to forms, it could be related to some of the other modules that we discussed, or even any general comments, or even, the private.
So help desk question. The answer is yes. We'll be sending out a link either late today or sometime over the weekend. And we'll also make the video available on some of our social platforms as well. But we're glad you're here because you get to ask questions live and get them answered. What other questions do we have? All right. Where can you access integration instructions for your specific EHR?
Harry, is our webpage available? If not,
we don't have that webpage available yet, but they can have someone reach out to you, Shayna.
Certainly. Yeah, Shayna, certainly we can have someone from our support team reach out to you to discuss integration specifics. Feel free to let us know your name of your practice so we can have someone reach out to you. Any other questions? Yeah, Yemi, great question. Again, if you provide us the name of your practice, and we'll have someone reach out to you specifically to speak to solutions that would work for your practice. We got one from, I think that's Front PC. When do I say date of birth would show in the contact info for text messages? So right now, if you're currently an integrated customer, date of birth does show in both contact info and in the search menu. If you're not yet integrated, I suppose we can open up a field to allow you to enter date of birth or upload date of birth. That would be a good suggestion for some of our integrated folks. Hey, Harry, I see Shayna and both Yemi both access information. So
I've got that. What other questions do we have, folks? We're happy to We've got John. We're happy to answer questions.
Certainly, or general comments, feature requests. You have the product manager right here, so anything like that, I'd love to take a look. Sylvia, we'll send a video on flag sorting. Sylvia, could you share your practice name as well? I'm not sure if you've already done that. Astro, I think we have.
John, do you have the ability to open up your demo account? I could give you
A copy of
screen
this
sharing and
training?
and just show off the filter, the flag sorting.
We do have, Denora says, can we get a copy of this training? Certainly.
Yes, we'll be sending out a recording to everybody.
Jana says, can you or will you be able to provide more websites in the feedback portal? So we do pull more than 3 websites in, I'm assuming you're talking about review management here, but in our review management section, we allow you to connect your Google and your Facebook accounts, but we also pull data from various websites. I think we have up to 12 different websites. Question from Selena. That's actually a great question. I see this often. Selena asks, when a patient texts cancel and they're opted out of messaging when they're really just trying to cancel their appointment, is there a way to avoid this from happening? And normally the opt-out messages stop. So cancel is actually, it's like a federal implemented guideline from text providers. So anytime a vendor, such as your practice, is texting a customer and they reply cancel, they have to adhere to the guidelines and stop messaging. So one way I would suggest is to essentially try and phrase your reminders in a way that implies that they cannot cancel their appointment via text. That's usually the biggest help. I'm sure our customer support team has more improved solutions that they can talk to you about if you have questions about that. Help desk. We can only use chat or support at Doctable for help. Never been able to get the Fresh Desk help account set up. Okay, I see what you're saying. I believe we have some type of documentation to guide you through setting up the Fresh Desk help setup. So that's in the upper right-hand corner of the dashboard. There's a help button. If you click that, it takes you to our Fresh Desk site where you can request a ticket with our customer service team. So if it just keeps going in a loop, I'm certain, fairly certain we have a documentation for that, and then our customer support team should be able to help you. If you can't open a ticket, obviously, they should be able to help you via Fresh Chat. Stop the loop. Shayna gave a great suggestion. We tell patients to reply with letter X to cancel their appointment. That's a great suggestion as well. So yeah, you could say reply letter X to cancel the appointment. That's good. That's a great suggestion.
This is exciting. John, I was asking before, do you have the ability to demo the flag sort?
I'm trying to get into my dashboard right now.
All right, you do that for a moment, and I will run one more poll. This is related to if you're running a restricted waiting room, how you let folks know to come in. And if you could answer that right now, if you'd like. And while John's trying to get that demo brought up. Thank you. I see we got a few responses, so that's always appreciated. Got a bunch of people making phone calls, John. You could be sending text messages.
Yeah, exactly. Virtual waiting room. I think aside from our listening potential to have an additional virtual waiting room webinar afterward, to really address with maybe someone on our team, essentially to help you improve your waiting room offering and help you virtualize it. Okay, I had a question here just to clarify with, see here.
It was Sylvia, I think, with the color flag.
Yeah, I believe Sylvia is asking about flag sorting. I think it is along the lines of the earlier question with sorting by sender who's sending the messages. I think I may have misunderstood your question, but I believe you're actually asking to be able to sort within the flagged inbox. Is that correct?
Yes, she says.
Yes. Okay. So that's something we don't currently have, but that is something we're planning to implement in the next 2 quarters or so. So it should be happening this year. And again, these type of sessions are great for me to understand what type of customer use cases and requests are really going to help you the most. But I definitely see that being able to sort by specific color. So say you only want to see purple. That's something that we'd like to get done.
And sometimes
I just heard a misunderstanding there.
So no video for you, Sylvia, because I can't show it. But obviously, John and the team are working on it. Something that hasn't been scheduled, but sometime in April, May timeframe, we hope to do another one of these, or to look forward when John has the full kind of schedule of what the team is committed to and what they're able to do, or what's already been built or close to coming out. We'll have him back to address those. So definitely watch your inboxes for those.
Yeah, I absolutely would love to share what we're planning to address this year. Some of the big things coming. Great.
And the reason we don't give every answer right now to what's coming is because we want to make sure it really is doable, that it's coming, that it's committed. And we don't want to mislead anybody, might be possible, that sort of thing. John, this is great. And we do have a few more minutes. We have 10 or 11 minutes left, but I think we've mostly run out of questions, but please, we still have about 35 people here, or 33 folks in the audience, plus you and I. But if anyone has any other question, or just want to give John some feedback, something that you really like, something that is bugging you, now's a great time to provide that. And otherwise, if not, we're going to end this in a very short bit. It has been asked a few times. We will be sending out a recording of this. So sometime later today or over the weekend, we'll hit your inbox, and we'll also share it ultimately to social media and within the...
Your office takes in a lot of walk-ins. How would that work? I suppose my question would be virtual waiting room. Okay, I see. Yeah, so virtual waiting room, we can definitely customize the time that we're sending messages. Certainly if your practice is taking direct walk-ins, and I'm assuming you've got a walk-in and you want to see them same day, definitely a bit harder to virtualize if they're walking into your office already. But I'm certain we've got quite a few customers. I'm certain we have someone who has a very similar workflow as yours, and certain our support team would be able to help guide you and understand your case and make sure our product fits for you. We'd be able to search parts of names rather than the exact spelling. Yeah, Sheena, that's a good question. Again, I'm looking for enhancements for our patient communicator product. I think right now you can search for parts of names, but it actually requires 3 letters to be input. So we want to improve on that to search and basically start the search at 1 letter, say, for example, or searching for a specific part. Those are things that we're looking to address. And I'll have an update again on timeline, and probably in that next webinar that Harry was mentioning. But yeah, that's a great question. And again, we're certainly trying to address, I see it as an area of improvement, our patient communicator, especially for practices who have larger volumes of patients. That can definitely use an upgrade.
And I just had to suggest, I don't know if this applies to ALMA, but obviously if you are restricting who comes into the office and you have walk-ins, obviously putting some kind of QR code or a text number on a message on the door, please don't walk in, please text us, or please go to this link. And then there's lots of ways with the product to then, if you're able to schedule them, or using the regular texting and some of the templates that we have, where you could then send them the intake forms and all of that, so that they can go back out and outside or whatever, fill that in, and then eventually get the notice when it's their time to enter.
Another great question. Will we be able to store or send emails without having to upload the list each time? And here, I'm going to assume here you're referencing our campaigns product, and when you're basically uploading a list and then sending that out. Yes, the goal here is to make it as easy as possible for your practice to build a list and save that list. Again, I don't have a very specific timeline. I think our plan is to address that this year. I can't tell you a specific date, but I will let you know that that's something that we want to address as well.
And by the way, I thought campaigns might be an interesting way to additionally get out things like mask requirements. Use our campaigns tool, which sends emails. For those who aren't familiar with it, you could say between now and whatever date, we're asking everybody who comes into the office, please wear a mask before you come in. You could use some of those other reminding tools to also include that message, but the campaigns would let you get that out to a very wide part of your practice very quickly and easily.
Yeah. Again, within our patient communicator, we have a feature to broadcast a message to patients on your schedule. That's another way you can let a large amount of people know in a short amount of time. Instead of having to send it one by one, you can send it to anyone who's on the calendar for today that the mask is required. We have a lot of different ways to automate something like that.
All right, John, I think I'm going to end this in a moment. We're got about 6 minutes left. I don't see any new questions. I'll give anyone a last shot, but I really want to thank everybody for joining us today, especially yourself, all of our customers taking time away from their practice. It's appreciated. If someone comes up with further questions later on, obviously reach out to the team. You can email marketing@Doctable. That will reach me, and I'll be happy to forward it. I'm going to go back through these chats that we have had today and make sure that everybody gets responded to. But I've already passed on Shayna, Yemi, and Sylvia's requests to our team. And John, again, thank you. I'll let you have the last word.
Yeah, certainly. Everyone, thank you for showing up today. Look back at 2021. I'm looking forward to speaking with y'all again to give you a preview of 2022. But yeah, it was great having all the questions today. I really appreciate all the feedback on the product, and hopefully this is going to go directly into improving the product for you. Again, our goal is to make things easier for you, to automate the process for you, so you can focus more on providing the best healthcare possible. Thank you.